Hello, everyone. This is Yusuf.
And this is Daniela.
Welcome back to the Health Innovation Playground. Today, we are asking, why is the mouth the only part of the body where we accept amputation, drilling as the standard of care? To discuss the shift from drill and fill to predict and prevent, we have Dr. Manjushree Bagri. She's a dental surgeon from India, and she's our colleague in the Masters in Health Innovation and Entrepreneurship. And we're very excited to know from her, where is dental health heading? What's the future? How can we innovate in dental health? Hello, Manushree.
Hi, Yusuf. Hi, Tamila. And I'm really delighted to be a part of this podcast because you guys are brilliant minds. And with the conditions happening in Barcelona, it's amazing that the two of you still continue to run and play the show of a podcast. And yes, I'm a dental surgeon. I have a strong clinical background of 6+ years. And I genuinely loved clinical practice, but at some point I realized I was treating outcomes and not preventing them. I saw patients who could have avoided the pain, the cost, and the procedures if the right system, right education, and right technology was provided to them pretty early. And that's when it actually hit me that the problem wasn't dentistry. The problem isn't drilling and filling, but it is actually the ecosystem. So that is why I transitioned into data, innovation, and entrepreneurship.
Okay, from the patient point of view, we all know the dread of the dental chair. Is that fear just part of the deal? Or is the industry actually trying to fix the experience, not just the tooth?
So, okay, I'm really happy and impressed by this question, Tamila, because yes, this is such a pain point. But I'll tell you what, dentistry in general is not just a patient fear, which is psychological. I think it's more systemic. And I think, to be honest, for starters, it's actually the fear of uncertainty. I think the real struggle is trust and cost. So, fear of the unknown, the lack of clarity about, do I really need this? Do I actually think the cost barriers are keeping me away from moving in and taking the real deal? So, I think it's really important to solve the issues regarding accessibility, dental literacy, and transparency and dignity.
Yeah. So, since patients are really uncertain and they sometimes doubt if they really need the filling, could AI help us in a way to show them that they actually need it and help build the trust because we are confirming the diagnosis with data?
I think it's absolutely correct to bring in the use of AI at the moment, Yusuf, because AI is a key for assistance for sure. When AI, that is technology, combines with human diagnostics, the question automatically shifts from, do I really need this, to, okay, doc, when should we start? Because AI is helping me picturize something I'm diagnosing. I mean, I'm giving out a picture to a patient, and when the X-ray comes into play, he, I think, automatically certifies that, okay, yes, the doctor has a solid back end. So yes, AI is definitely helping me a lot. And I think dentistry, AI in healthcare in general is definitely bringing out a big change. So yeah.
But do you think the patients have reached the point where they would trust an AI?
Yes, I think we have a lot of examples in today's time. In my practice, even in the past 6.5 years, I've got to realize that there is a thing about 3D printing. There's a thing about people being more aware about dentistry in general. And I think that people have actually started to, replace the barriers that they already had existing when they got more aware about, okay, we can search about it, we can probably read about it, we can research about it. And I think AI has played a major role in that. So yeah.
Okay, you mentioned 3D printing, which is really interesting because it's a niche in the dentistry and in general medicine. I hear you can print the tooth in the clinic now. Is it real? And what are you printing it from?
Okay. So, as we talked about technology pretty recently, I think 3D printing and biomaterials are the top topic of the town. And yes, we can already print crowns faster than we prepare a particular tooth. And in the near future, we won't just print prosthetics, but we'll print biomimetic structures that communicate with both the tissue and the support of the entire dental system, and it'll account for regeneration and a better functionality in the near future. So yes, it's a chairside assistance, and of course the quality has increased, accelerated, and it's happening in real time.
And you think it's more accessible?
Of course it is. Yes, it is.
More.
Yeah, absolutely. See, I wouldn't really talk about cheap because the quality and the effort behind it is immensely, impressive. I can quote an example. Earlier, when I started as an intern back in my undergraduation days, I remember my patients used to have a lot of gagging because I was using alginate to prepare an impression. And all the time, as students, we're not born perfectionists. So it used to be once, throws, a lot of times maybe. And then later on, when my practice started and I got into the real-time experience of it, I could see, I could see and use impressions which were 3D assisted. There was no alginate. It was being replaced and my patients were happy. Oh, doc, it's done already. There's no gagging. And I think they used to look forward for that time that, okay, this is probably going to be a gala time where they'll also see an image of their entire dental system, their mouth, and also giving me an impression. So I think, yeah, 3D printing and the use of technology has been a beautiful thing. Of course, it's qualified. So the quantity is, the pricing and the things regarding it do alter. But I think it overall has added value and it gives a beautiful experience to the patient.
As a patient, in one single sentence, how would my experience differ with these new technologies?
Like I quoted, when you walk out of my clinic now, I think you'll be impressed by the kind of technology and quality I'm using. You wouldn't be experiencing the gag, the lots and lots of time sitting at that dental chair, thinking, oh my God, when am I going to get up? When do I get done with this? Mm-hmm. It's more or less going to be an impressive time saving and, I would now say an enjoyable experience, of course. So, yeah, it has altered a lot of things in general.
I used to work as a radiologist and we used to use a lot of robots in surgery and things like this. Is dentistry using robots yet or is it still science fiction?
No. There are certain parts which would always need human drilling, and I wouldn't sugarcoat, I wouldn't buttercoat anything. But yes, there are really lots and lots of parts where robots and robotic surgeries have been added in dentistry because it's giving out precision and it's saving a lot of time. And also it is less invasive, less bloody, with human and manual touch. Whatever it is, my scalpel was not able to give me that right amount of precision. But now robotics in dentistry has definitely created a lot of changes. Of course, it's still evolving, but yeah, it's very much in use. Yes, it is.
Okay, if AI identifies a cavity and a robot drills the perfect hole, what happens to the dentist manual skills and how the whole train of new surgeons in dentistry is changing?
Okay. Thank you, Tamila. I think this is a very impressive question. And just to summarize how we talked about robotics AI in dentistry, I think at the end of the day, it is a combination of my knowledge, my conventional practice, my dexterity, but I'm combining it with the new generation robotics and technology to bring out a precision skill out. My skill will remain inevitable, but I'm giving out a better experience, a better precision activity to my patient in a more functional and more impressive manner, I would say.
So if the skills are not your hands anymore because the robot can do it better and the AI can see it better, what remains that the dental surgeon really contributes?
Oh my God, it's, I think, empathy.
Yeah.
And that's the key. Why would my patient sit with a robot when they are not even consoled or emotionally, connected enough to feel that, yes, I'm being empathized with? My robot can't do that. I think as doctors and as healthcare professionals, you guys can understand me the best how essential it is to bring out empathy, and I think that's the key of innovation as well. So yeah, that's what a healthcare professional is doing. Actually, I think.
When you said before that as working as a dental surgeon, you felt kind of frustrated. Can you get into the details how this reality felt to you?
Yeah, I think we're coming to a topic which is certainly needed to be talked about. I think it's the burnout that we want to come to. And I think dentistry today is stamina based and it's not system based. So we rely on physical endurance instead of workflow intelligence. And burnout isn't actually a proof of weakness, but it's actually a proof that the system is outdated.
Mm-hmm.
And I think that's where we need to work. That's where we need to bring out a change. And we really need to, emphasize on the fact that how can technology do the heavy lifting so that dentists or healthcare professionals can work faster and in a more strategical manner.
Mm-hmm.
So yeah, it's important to talk about the quintuple aim and all the aims where we're focusing on doctor wellness, welfare as well.
Mm-hmm.
Okay, now the dentistry actually changing with the new technologies. A part of all the things you need to learn, I guess now you also need to learn about innovation in dentistry, right?
Yeah.
So you transitioned into technology.
Yeah.
Why? What was it? The frustration with the old school teaching?
Okay. So I'll tell you what. I transitioned from clinical dentistry into data and tech to actually work on the root cause of things. So I didn't really technically walk away from dentistry, but I stepped back to understand what is the root cause and how can I fix it possibly. Yes, there were parts and times where I did feel frustrated and I was feeling that, yes, I'm being drained and I'm working, but am I really adding value? Am I really doing something which is probably bringing out a bit of change? So there were obviously tools that I was working with, but they weren't the efficient tools, I would say. And then data analytics and digital health and all of these skills gave me a bigger scalability. And I thought that entrepreneurship could possibly build solutions instead of me waiting for someone to create them. So my purpose was never to leave my profession, but it's just to evolve with it.
Can you paint a picture for us, your transition to data analysis? What was your daily workflow like? What value does it add to you? What do you get out of it? I really can't picture it.
Okay. So if we talk about that, my clinical training taught me precision. It taught me empathy and responsibility towards my patients. Okay. And that is, I think, inevitable. But my data experience taught me to zoom out and see patterns. Where is actually the issue happening and how can I actually work on the minutest of details to bring about a bigger change?
Can you give an example?
Yes, I can, because I think innovation in general has taught me to ask better questions and not just find better answers. So I think that if I have to quote, we have a big hospital OPD and we have lots and lots of data. Where is the credentiality? Where are the patterns where we're actually trying to reduce waiting times for my patients? And how am I incorporating my target audience or the necessity of a certain drug which needs to be developed to fight a certain rare disease or to fight a certain thing which could probably, incorporate technology with healthcare and bring about a real change? I mean, if I was to elaborate more further, the company I was working with, sorry, I can't name it in general, but I just want to give an example. With the clinical background that I had, I was picked amongst lots of Indians to work on it because I had written certain scientific papers wherein I was trying to deal with dealing liver cancer at an early stage by the use of gingival and salivary markers. And they were working on developing a drug which could possibly be helpful just by picking certain biomarkers and targeting the right kind of audience by collecting data, EHR, and all of these analysis and, research. So I think that's where technology has taken over the conventional methodologies of sitting with lots and lots of data and trying to work about, okay, it's time to maybe bring out a new drug in the market. Maybe it might work, maybe it might not work. But now with technology and everything, we can target the right kind of audience, incorporate a lot of data. We have so many tools these days just to figure that out. And then we can probably bring about a big, massive change in the pharma industry. So, yeah.
In simple terms, this means for a patient.
For a patient, in simple terms, it means that, yes, I'm trying to give you a convenient, user-friendly experience at your home. Like I mentioned, the company picked me up because I was having details regarding the exact kind of biomarker panel needed to prevent or detect systemic issues at a very early stage. I can't really talk about the product as much right now, but just to give you an example, we have a lot of companies who are actually working with pH strips, and they are being marketed in the industry as user-friendly home kits, wherein the user takes it to their home from an IKEA store or a pharmacy store, choose on the pH strip, and they get a colorimetric, representation, and they scan it and they get to know, oh, okay, I need to visit a physician. My iron levels are not working well, things like that. So this is a very layman example, but this is how technology is helping healthcare bring about a bigger change. And I think this is what innovation is about.
So we can say that the mouth will become a lab to test.
Yes, absolutely. Thank you, Yusuf, for bringing that out. But I just want to, quote one very essential statement. The mouth is the mirror of the body.
To the eye.
Well, I think the human body is in itself so dynamic and it's so beautiful in general. I'm just going to quote something. We were talking about this with our colleagues as well. There's a bad flu going around in Barcelona. And we have a lot of supermarkets here, just to quote Mercadona, for example. And it is actually building class 2 and class 3 medical devices. But they have a lot of supply for the class 2 medical devices. And I think they're over the counter. I recently purchased nasal drips. They are saline-infused vials. You dig them in your nose, you dig them in your ear, and you're good to go. Lots and lots of, it's working like an expectorant. And I think this is how innovation works for me. I didn't have to go to the doctor. I didn't have to go stand at the pharmacia, spend lots and lots of money. This was affordable for me. And it was a very good way of debriding whatever was inside me. And that's the reason I'm here for the podcast, guys. So I think this is what innovation is about, right?
It's accessible.
It's accessible and it's cute and it's easy to use. Yeah. And it's Mercadona. So I think,
Yeah, that's very simple now. So patient, what we like, no small, usable.
Exactly. And
What you bring in to dentistry.
yeah, and I think that's my major aim because I really want people to understand that dentistry is not just confined to the 32 small pieces that you have in your mouth. It's actually a mirror to your body, and you can really bring about a lot of changes if you get to know about it.
As a doctor, I don't think so.
No.
Well,
Yes, we need to sit over lots and lots of deep discussions then.
tell me how. Like, convince me otherwise.
Okay, I think it's good that we have two ladies, beautiful ladies, just by the way, in the room. And Tamila is a healthcare professional just like me, and we have exhausting hours and, whatnot. For us, okay, we might just think that maybe it's just the tiredness, maybe it's lethargy, which is kicking in because of the long working hours. But deep down, someone else just comes to me and I see that their tongue is showing me lots and lots of changes. There are papillary degenerations and there are, signs of angular cheilitis and whatnot. Being a professional with a lot of medicine knowledge, I just ask my patient or my coworker, or maybe, we're sitting and I just ask her to probably get a, CBC done, check her hemoglobin levels and iron levels, and booyah, she's iron deficient.
Mhm.
So, what did she do? Hey, what do you say, Tamila? I think I quoted a pretty good example, don't you think?
Really, no, I think you're right. Maybe it's not a mirror to our souls, but it's a big tool to diagnose.
Really. Oh my God, there are so many patients who come to me and they're like, doctor, my teeth are drifting away and I am constantly I'm having bleeding gums and oh my God, I keep going to the washroom, lots of, days and days. I'm urinating. What's the issue? Is it something serious? Yes, you have diabetes. Yes, there are alarms which might just take you to maybe a cardiac problem or something. So you've come to the right person. It's just that the mouth will show us the right signs only and only if you read well in your undergraduation days. It's very important to be a good student and So I think I won my case, Yusuf. Don't you think?
Yeah.
Somewhere.
Yeah, I agree. You mentioned a lot of things, and we know that gum disease is kind of linked to heart disease.
Yeah.
And now we can hear about biohacking to live
Mm-mm.
longer.
Yeah.
Why isn't oral health considered a pillar of longevity yet?
Like I said, there is so much, people are devoid and people are not really aware about dental health. Dental literacy is a major concern. And I think young innovators, young minds, young professionals like us can actually bridge that gap. Like I quoted for you just 10 seconds ago, you thought that, okay, I need to probably stand out and give you a very solid example of showing that, yes, mouth is the mirror of the body. The moment I gave you an example, your mentality changed and you sort of were in favor of it. So I think we need to, young minds like us need to talk more about this. And I think that is where we bring about change and make things more evitable, Yeah, I mean, they can accelerate from this point on if the right knowledge, right methodology are given to the right kind of people at the right time. So, yeah.
Do you think it's a problem of dentists where nowadays insurance doesn't even cover dental problems and probably most people pay out of pocket for their dental issues? Isn't that problem?
That's where innovation kicks in, like we were talking. We have to make it accessible. In a very general way, I want to talk about something that I always dreamt about. In India, you still have certain ways and certain methodologies to cover high cost treatments. Yes, they wouldn't be, covered through some insurance or through some policy, unless, of course, you get hit by a truck or you damage your face or your jaw altogether. But still, I think it's kind of affordable, kind of pocket friendly. But I also think that it's maybe because lots and lots of untrained, unskilled professionals, commonly called as quacks, are running practices which aren't really ethical. But then there will always be a set of people who empathize, and therefore they have, this concept in their head that, okay, I need to help the society, so I'm bringing out accessible rates. But here in Europe, since the time I've moved here, I think this needs to be really, really, really worked upon. So the plan I wanted to talk to you about was bringing about a real change, and I was thinking about getting a dental van or a dental bus on the road, by the name of Roads to Smile, or Smile on Wheels, where I was going to incorporate technology with empathy, healthcare, and bring about a real change for people in Barcelona in general. If I talk about, we were going to incorporate biomaterials and sterilized instruments create dental carnivals to incorporate dental knowledge and games and ways to make it more accessible, interesting, and something that could, probably make people feel that, yes, dentistry is not just something that has to be ignored. It is something which is essential. And I think I wish, and I really wish this someday becomes a real thing. So yeah, that's about it.
I see the bottleneck is at the public health level, since the government doesn't endorse dental problems.
Yeah.
How would you convince the government that dentistry should actually be insured, should actually be covered?
I think World Hebron has given us a lot of passages and a lot of ways. And even the company that I am working with, or places that I worked with before, have actually made us realize that things like grants, researches, and academic, assistance can actually help us collect the, funds, and then probably go about it to talk about it to the Ministry of Health. And I know it's a hustle and it's a big, big step, but I think when they see some real content, real idea, real backdrop, and like we're always told, we need to empathize and hit the real target, hit the real spot, I think it might bring about a change, and I might be able to, maybe convince them.
Okay, let's go back to innovation in dentistry.
Yeah.
And will we ever see a day where we stop drilling holes and start growing enamel? And is regenerative dentistry real? What do you think? And maybe it can be even accessible and more cheap, maybe.
Like I said, it's difficult to talk about this and comment on it as of now, to be honest, because when we talk about making it cheap, wouldn't be an easy game, to be honest. Yes, dentistry is so regenerative, and stem cells, and I don't know, you name it. And we have so much so happening. There are studies which are actually, they're actually talking about growing an entire tooth once again, like a rebirth. And I'm sure.
Goodbye implants.
Yeah, exactly. Because, I mean, imagine who would have thought something like an implant would also come into picture someday. People were walking without teeth, and I don't know, but over the years, so many people are actually getting implants and getting the knowledge about it. So I think pasito, pasito, how do we say it in Spanish? Poco, poco, people are learning that yes, there are treatments, there are ways, and there is always going to be a genre, a community which is ready to pay. And then I think they will be the biggest example setters. Okay, it's time. We are getting it done. They are getting it done. Maybe, okay, let's just see what is it about. And then, the hierarchy follows.
Yeah.
So yeah, that's about it.
Let's imagine a future, and maybe in 10 years, instead of coming to your clinic for a checkup, can I just take a picture of my teeth with my phone, and maybe an AI tells me if I need to come in, if I have a problem or not?
Yes, absolutely. And just a few minutes ago, I talked about this, how I was telling you about the pH strips, which are working on a very innovative model. And like I said, I can't disclose about what I'm working on, but yes, I'm really hoping that my project comes into play. I'm working on this, Yusuf. I'm actually working on this, and you'll just sit in your room, which, by the way, guys, is an amazing room. I think it is an amazing setup. You're going to sit here and you'll be like, okay, Shri, I'm clicking a picture and let me just see. What is it? Yeah, it's troubling me since a lot of days. You click it and booyah, the AI tells you, okay, Yusuf, it's time for you to visit this, maybe a specialist, maybe a periodontist, a diabetes specialist, whatever. And yes, you go there. You get to know about it. I'm working on it.
I see accessibility here, yeah?
Yeah, absolutely. And I'm telling you, I'm going to keep everybody in mind because I come from a very loving country. India always keeps in mind things about people and we're warm. So don't you have to worry about it at all.
That's interesting. I think the dentistry in general, it's not that covered yet.
Yeah.
I hope, Manjushree, you're here to give us all the information, all the knowledge about dentistry.
Yeah.
So, as a patient of tomorrow,
Yeah.
what is the one question I should ask to my dentist to know if they're keeping up with now times?
Okay, that's great. This is where I'm happy that my patient is well read. She's aware where is she coming from, and she knows what to ask me, because that might maybe put me in the spot if I'm not updated. But I think I'm anyway going to give you, Tamila, a 20% discount for being so well read and coming to me and walking in my clinic. But yes, that's exactly where I'm going to talk to you and bring out the, major idea about it, where I'm going to tell you that there are things that I'm working on. I wouldn't give you any false hopes, any false promises, because I will always have barriers. But I can assure you one thing: when you walk out from my clinic, you will have a 5+ rating, and you'll carry an experience where you'll feel that, yes, I was, addressed. I was heard. So in today's time, you should be definitely one thing that you should be really learned about is, doctor, I hope you've checked everything properly, because I don't want to come to you when it gets decayed, when it gets rotten. I want to be aware that I'm being prevented from it. So healthcare should be prevented. And that's exactly where a young mind like me wants to work at. So I think that is what you wanted to know. And I think I pretty much cleared it and cracked it. Yes, I think dentistry or healthcare in general now needs to be preventable. So yeah, that's about it.
So now I will ask some questions and I want quick answers. A rapid fire session.
Okay.
One myth about dentistry you'd like to bust.
One myth about dentistry, I think accessibility and expensive. Please come to me. I'm going to treat you right.
Okay, one word to describe the future of healthcare.
Preventive, definitely preventive.
Your advice to healthcare professionals considering innovation.
Guys, please update yourself. Use the new skills that you have. Technology is amazing. Incorporate it, please.
Okay. Thank you, Shree.
You're welcome.
This was a very nice talk, and we were really happy hosting you.
You're welcome, guys.
As I said before, I think dentistry should be more covered and more explained everywhere, to be honest.
Yes.
Really. I think it's a real problem for everyone. We all have, how many? 32?
Oh my God, Tamila.
There's 32 problems, and I think they don't finish. Yeah, we have child tooth, adult tooth, we have very adult tooth, which is a more problematic.
Yeah, absolutely.
And I think people who start to have issues with teeth,
Yeah.
they really need to know what to do and how to treat it.
Yeah, absolutely.
Because it can become a real problem. Yeah. And here we go with innovation. And thank you for all explanation.
Thank you, guys. Thank you for having me here.
Dentistry industry.
Yeah.
And please keep up with us.
Yes, absolutely.
Thank you, Yoshi. And I will have to confess something.
Yeah.
I only went to a dentist once in my life.
You like it.
To remove one wisdom tooth.
Yeah.
And maybe after this episode, I should come more.
Yeah, absolutely. If you ever, I don't know, but
You're gonna take me in for free.
Oh, I mean, I'm for
Robust. I will use it.
I really want to end once. I really, first of all, guys, thank you so much for having me here. Like I said, you guys are doing an amazing job, and I'm so happy to have great minds like you guys around me. There's just one thing that I wanted to probably end this podcast with. I don't want dentists and, budding dentists especially to confine themselves to clinical chambers. My background, I want it to become an inspiration for a lot of people. I was a dental surgeon. I have a very solid experience of root canals and whatnot. I've written scientific papers, yes. But I think my background should actually, tell or send out a message that we really need to work on a lot of things, and we can do it.
Like what? List a few.
Like I just mentioned, we need to make dentistry renowned. We need to make it accessible. We need to make people aware that it is not something which has to be ignored. We have to, bring about real change by making it more dignified and transparent.
Okay. Thank you, Shree. That was very nice.
You're welcome, guys.
Thanks for everyone listening to us, and see you next time.